What is the primary determinant of cardiac output? A. Heart rate. B. Stroke volume. C. Blood pressure. D. Vascular resistance. Answer B. Stroke volume. Which of the following factors affects stroke volume? A. Heart rate. B. Blood pressure. C. Preload, afterload, and contractility. D. Blood viscosity. Answer C. Preload, afterload, and contractility. Which of the following accurately represents the formula for cardiac output, CO? A. CO equals heart rate times blood pressure. B. CO equals stroke volume times blood pressure. C. CO equals stroke volume times heart rate. D. CO equals heart rate times end diastolic volume. Answer C. CO equals stroke volume times heart rate. Which of the following conditions would increase cardiac output? A. Increased heart rate and decreased stroke volume. B. Decreased heart rate and increased stroke volume. C. Decreased heart rate and decreased stroke volume. D. Increased heart rate and increased stroke volume. Answer laughing face, increased heart rate and increased stroke volume. What effect does sympathetic stimulation have on cardiac output? A. Decreases heart rate and stroke volume. B. Increases heart rate and decreases stroke volume. C. Increases heart rate and stroke volume. D. Decreases heart rate and increases stroke volume. Answer C. Increases heart rate and stroke volume. Which of the following factors directly affects preload, thus influencing stroke volume? A. Blood viscosity. B. Heart rate. C. Venous return. D. Vascular resistance. Answer C. Venous return. Which of the following is not a component of the Frank-Starling mechanism? A. Heart rate. B. Preload. C. Afterload. D. Contractility. Answer A. Heart rate. Which of the following accurately describes afterload? A. The resistance against which the heart must pump blood. B. The volume of blood in the ventricle at the end of diastole. C. The force of ventricular contraction. D. The amount of blood ejected by the left ventricle in one contraction. Answer A. The resistance against which the heart must pump blood. Which of the following factors primarily determines systemic vascular resistance, SVR? A. Heart rate. B. Blood viscosity. C. Blood volume. D. Arteriolar constriction. Answer laughing face, arteriolar constriction. What is the term for the volume of blood ejected by each ventricle in 1 minute? A. Cardiac output. B. Stroke volume. C. Heart rate. D. Ejection fraction. Answer A. Cardiac output. Which of the following factors primarily determines venous return to the heart? A. Arterial blood pressure. B. Venous compliance. C. Skeletal muscle contraction. D. Respiratory pump. Answer C. Skeletal muscle contraction. Which of the following occurs during the isovolumetric contraction phase of the cardiac cycle? A. The atrioventricular valves open. B. The semilunar valves close. C. Ventricular pressure decreases. D. Ventricular volume remains constant. Answer B. The semilunar valves close. Which of the following represents the normal ejection fraction, EF, of the heart? A. 40 to 50%. B. 60 to 70%. C. 20 to 30%. D. 80 to 90%. Answer B. 60 to 70%. Which of the following factors directly affects contractility of the heart muscle? A. Venous return. B. Blood pressure. C. Sympathetic nervous system stimulation. D. Blood viscosity. Answer C. Sympathetic nervous system stimulation. Which of the following accurately describes preload? A. The resistance against which the heart must pump blood. B. The volume of blood in the ventricle at the end of diastole. C. The force of ventricular contraction. D. The amount of blood ejected by the left ventricle in one contraction. Answer B. The volume of blood in the ventricle at the end of diastole. Which of the following conditions would decrease cardiac output? A. Increased stroke volume and heart rate. B. Decreased stroke volume and increased heart rate. C. Increased stroke volume and decreased heart rate. D. Decreased stroke volume and heart rate. Answer laughing face, decreased stroke volume and heart rate. Which of the following represents the formula for stroke volume, SV? A. SV equals N diastolic volume, EDV, N systolic volume, ESV. B. SV equals heart rate, HR, times cardiac output, CO. C. SV equals CO/HR. D. SV equals ESV EDV. Answer A. SV equals N diastolic volume, EDV, N systolic volume, ESV. Which of the following accurately describes the effect of increased sympathetic activity on stroke volume? A. Increases preload and decreases afterload. B. Decreases preload and increases afterload. C. Increases preload and increases contractility. D. Decreases preload and decreases contractility. Answer C. Increases preload and increases contractility. Which of the following factors primarily determines venous return to the heart? A. Arterial blood pressure. B. Venous compliance. C. Skeletal muscle contraction. D. Respiratory pump. Answer C. Skeletal muscle contraction. What is the term for the volume of blood remaining in the ventricle at the end of systole? A. End diastolic volume, EDV. B. End systolic volume, ESV. C. Stroke volume, SV. D. Cardiac output, CO. Answer B. End systolic volume, ESV.